With 2025 coming to a close in a couple of months, the Medicare open enrollment period is now open. That actually happened just yesterday.
For senior citizens, the best answer isn't always cut and dried. Heather Leddick is with the New York State Office for the Aging. She joins us live now. Heather, thank you so much for taking the time this afternoon. Let's start off right off the top with the changes to Medicare. What should people know?
Well, great. Thank you for having me. And yes, it's important for people to know that we are in the Medicare annual open enrollment period, which runs October 15th to December 7th. This is the time for people to take advantage and take a look at their plan, what they currently have, and what their options are for 2026. People can make changes now for their Medicare Advantage plans. They can make changes to their prescription drug coverage. And the most important thing is that they really take a look at what they're receiving in the mail. Notices are coming from plans indicating maybe their plan will not be renewed for 2026, or maybe there's changes to their drug formulary, their provider network, or their hospital systems in their area. So it's very important that beneficiaries take a look at those notices they receive in the mail. And if they have any questions, of course, reach out to us at HICAP. They can reach us through our 1-800-701-0501 toll-free line.
And Heather, of course, with the federal government shutdown continuing here for over 2 weeks, a lot of people probably have questions about whether that at all is going to impact their coverage. What do you say to them on that?
Well, yes, we are in a dynamic environment. There was some guidance that came out yesterday from Medicare, and we're still in the process of analyzing all of that. But as you know, the situation is evolving at the federal level, and we just want beneficiaries to know that if they have specific questions, they should definitely reach out to us at HICAP. We can take the time. Our counselors are trained and certified, and we'll take the time to discuss their specific concerns.
When it comes to open enrollment, I know we're specifically talking about older adults here, but it doesn't matter your age. It could still be stressful and confusing. Heather, what are some of the most common questions you hear, or maybe even mistakes that you see people make during this time?
Well, you got it right. It's frustrating, it's confusing, and Medicare beneficiaries are doing the best they can to understand all this information. I don't like to say mistakes. I do say that we encounter beneficiaries that have experienced some complex issues in relation to, again, their provider network, their prescription drug formulary. And again, we just want to discuss that with them, and they can reach out to us and we'll provide them that individualized counseling. Again, we're free, objective information, and we can really discuss their personalized needs with them.
Heather, let me also ask you, we know about the open enrollment period going for the next couple of months here, but after selections are made, is there any possibility that families can kind of go back into the past and change anything in terms of their coverage, maybe later this year or in the new year?
Yeah, that's an excellent question. So actually, there is a Medicare Advantage special enrollment period that follows the Medicare open enrollment period, and that runs from January 1st to the end of March. So folks can reach out to us and make a change during that time. And again, they should reach out to us with any questions or concerns that they have during the new year. When they go to their pharmacy, when they go to their provider, if there's something that just doesn't seem right to them, they can give us a call and we'll help walk them through that situation and resolve.
Yeah, Heather, I know you just went through a lot of stuff for our viewers.
Yep.
Very quickly before we let you go, I know you mentioned the counseling service. There's also the Medicare Savings Program. If people have just general questions, what is the best way to get a hold of your office?
So again, it's through that 1-800 line. So it's 1-800-701-0501, and they'll be connected with a trained certified counselor in their area to provide that one-on-one assistance. We have over 700 counselors statewide working on the program. So they should give us a call, reach out to us. We're here to help, and we're here to ease some of their anxiety and their frustration during this busy time.
All right, there's the number, there's the website, there's the QR code as well. If you want to grab your phone, scan that QR code, it takes you to more information that Heather was just talking about. All right, Heather, thank you.
Thank you so much.
Thank you.